This patient is a male with very strong bone structure with recurrent decay on all of his teeth. The incision is made slightly superior to the papillae, anticipating bone reduction. After the flap is raised, in order to remove the teeth and preserve as much bone as possible, a piezo surgery unit is used with a peritome tip. The teeth are then removed sequentially and the flaps are elevated, as you see. At this point in the procedure, the stent is placed, which has the flange marked at 15 millimeters. A pencil is then used to mark the line, which will then delineate the removal of bone. In this patient, a piezo surgery cutting tool is used, although a reciprocating saw could also have been used in this patient. The bone is just simply too dense for a rongeur forceps to be used. And with some care and consideration of to avoid burning of the bone, the bone is removed first on the labial and then on the palatal aspect. Most of the time, the palatal bone needs to be removed a little bit more. Then the stent is placed and the first molar location is marked with a round burr. After the round burr is used, then the lateral part of the maxilla is exposed and transilluminated. The line is made, and then the implant site is prepared with a pilot burr. The angle is confirmed. The perio probe is used to confirm that we're in bone, and then the final drills are used. The bone is quite dense, so some care is taken to use the burrs at a relatively slow RPM with copious irrigation. After the left side posterior implant is placed, the same procedure is performed on the left side. You can see the angle that's used. The bone is quite dense, so sometimes you have to work at the drills. Then the other implant sites are then marked with a pencil, and the sites are developed using the appropriate drilling sequence. Pilot drills first, and then the implant sites are prepared with the implants bisecting the cortical plates. This will allow the maximum engagement of bone and length of the implants. After the implants are placed, as you see, the torque is checked, and as long as our primary stability is good, then the abutments can be placed. This is showing preparation of the sites on the right side of the patient's mouth, and the implants are then placed. So he has 6 implants in the maxilla for a full arch provisional. Additional bone is removed to allow the placement of the abutments. The angulation of the implants will necessitate often removal of the distal aspect of the bone because of the angle. After the abutments are placed and confirmed that the angle of placement of the abutments is appropriate, they are then tightened down and secured in position. Many of these patients have excess soft tissue. Prior to removing the soft tissue or prior to closure, the index is made with the upper denture. A bite registration can be used to guide the denture into the appropriate position if needed. In this case, this was done. The bite registration material is placed on the intaglio surface, and the implant sites are now visible. You can see that the angled abutments and the placement allowed the emergence of the implants in the appropriate position. At this point in the procedure, bone harvested from the drills is placed.